Thank you for watching KT and welcome to this edition of Health and Wellness. Today, we talk about nurses, their role in our hospitals. We reckon that the Nurses Week is 6th to the 12th of May. But today, we want to talk about the nurses and the role that they do play in our health facilities. And to have this discussion is Jacqueline Tinde, who is the Deputy Director of Nursing, Kenyatta University Teaching and Referral and Research Hospital. Jacqueline, how are you?
I'm fine, thank you.
First of all, we just want to give our flowers to nurses out there, because whichever way you want to look at it, nurses are the MVPs of our hospitals, because most of the time a doctor would come there, they would do their rounds, but it is the nurses who stay with patients from beginning to the end until discharge. So we want to give you your flowers. But while at it, talk to us about the role of a nurse in a hospital. When I walk in, at what point do I get to mingle with a nurse?
Thank you. First of all, I would like to say I'm Jacqueline Tinde, and just as you mentioned, I'm the Deputy Director Nursing Services. And before I talk about the role of a nurse originates from somewhere. Many times people think that nurses have just come from anywhere, and then they came and they found themselves at the bedside and they work. But the thing that is very critical is that these are people who went to school and got very good grades that helped them to achieve the qualifications to be a nurse. Majority of the nurses, as we talk currently, cannot be able to become nurses if they do not have a strong C grade or C+ and above. And if you get a C grade, you must get good grades in science. So that's where nursing begins. Without that, the regulations in the country for the Nursing Council, you are not able to be picked as a nurse. And that's where the path starts. And many of them walk those journeys before reaching nursing because of the difficulties in the economics that we have. Some nurses originate from starting certificate courses. Some nurses originate just like me. If I would give a history, I originated from being shamba girl for 1 year in the shambas of Karimuguga, where I used to wake up. It was my job every morning, and I used to go and work until 5 p.m. I did that work for 1 full year until one day when the supervisor went to defend his project in the US. The one who was left gave us a very big portion of land to cultivate, and he said, there is no difference between a woman and a man. All of you are going to work. And when I was busy cultivating a hard ground, I asked myself questions. I passed and got grades to go to the university. I've stayed for over 3 years without stepping into college. What is going to happen to me? And I hit that fork djembe very hard. Through it entered into my gumboot, and it stuck there. And they had to carry me to hospital. And that's when my dad said, I'm thinking maybe we look for you something else. And then I was taken to be a tea girl in one of the now most prominent organizations called Kenya Plant Health Inspectorate, that is KEFIS. We were one of the founders there, and I was one of the early workers who was also a tea girl. I used to cook tea and take to the offices and wash the cups and make sure I brought milk and picked the lettuce. If you know, previously there was no this digital transformation that has come. So you could go to one office to pick letters to bring to the bosses. And I said, I need to improve. Probably I need to start small courses, and I started going to do French. After I finished doing French, then my dad said, there's a course I want you to go and do. And I was given some papers to apply. And I applied at Nairobi Hospital. And lucky enough, I was called there to be a nurse. And I started my career there. Because I had stayed for a very long time without going to college, I worked so hard. And after that, I emerged to be the best academic and practical nurse. And immediately, I transferred to go to do midwifery at Mata. And I found myself now employed at Nairobi Hospital. That's where the journey of the nurse is. That's where the role of the nurse starts. And that's where majority of my colleague nurses, whom I can speak on behalf, they have very many diversities of where they started to be able to become nurses. Some of them were accountants before they chose to be nurses, ICT people before they chose to be nurses. And so now, what is this role that we do in the hospital? When we are empowered and we have gone to school and we have been trained on what to do to take care of a patient, because we go through vigorous training in all the schools, KMTC and the private colleges, and we are taught how do you handle a patient, how do you handle a needle. We started by injecting the oranges before we go to inject the real patients. And even holding that needle to inject that orange is also difficult. But you find that we start at those foundations. Then when we go to get the real patient, the role is well spelled out. We are told you use your hands, you use your mind, and you use your energy to save lives. So it starts by receiving the patient. Being a nurse who is compassionate is the beginning of the healing of the patient. People walk into hospitals with many issues, many expectations, but what do you do at that particular time that patient is vulnerable? You have to receive the patient, you have to settle the patient, you have to reassure the patient and tell the patient you're fine. You have to be quick in thinking, this person who has come here, what is it that has brought this patient in this hospital? And do I need to do A, B, C, D so that this person can go back home? So after settling the patient, taking the history, understanding what is the problem, and all this talking depends on the emergence of the situation. There are some situations you may not talk. You just need to save life. And saving life means what? Either preparing the patient to theater, or delivering the mother if the mother has come in second stage and the baby's head is crowning, or the patient just is either depressed or has been in suicidal issues. Many things bring patients there, but you must be able to be empowered as a nurse to know where do you start from.
And Jacqueline, you've painted a picture of a story of a nurse from the stories that even precede a nurse having to graduate and being able to be registered to serve, pretty much. And as we look at the nursing fraternity as we speak today, are we seeing that the value of a nurse is appreciated as should be within the medical circles?
Thank you so much. Currently, I can say that the value of the nurse is being recognized. And it is starting up because of the foundations of when the nurses realize that they need to be empowered. They need to go to school. I can give an example of our first professor, Professor Lucy Gitonga, who is the dean of Chuka University, was the first professor nurse. And many more have come up, like Professor Ndirango Eunice, who is the dean of academic at Aga Khan University. And they are emerging currently, doctors coming up. And this has helped a lot for people to realize that nurses are not only maids, because people used to take nurses as the people who only take instructions from the doctor, and then when the patient complicates, they go and say, doctor, this patient has complicated. No, we have come up and been recognized that we can be able actually to take up roles, leadership roles. Previously, you've had one of the CEO who was in Kenyatta University and Farrell Hospital was Mr. Ahmed Dagana being the CEO. And many other leaders are emerging up. Dr. Awinja, who is at the MOH, sitting at the table with the ministry, making decisions and policies about nursing. So we are talking about this issue about being empowered. And I am very happy that now we can be able to be listened to. And we are still pushing through various bodies to ensure that we are heard. Because when we are hard, when we sit at the policy table, then we are trying to advocate as leaders to make sure that the nurse on the ground has a safe environment where they can be able to deliver care so that they can be able to save life. This cannot come out easily if that nurse is not empowered, if that nurse has no safe space, if that nurse is intimidated, they will not be able to give quality care and save lives. So what I can say is that we continue to work with the government, we continue to work with the other bodies and other partners. We are also trying to empower nurses so that this profession can be known that it's truly the heartbeat of the hospitals, by even helping nurses to have observership programs, which right now are being rolled out by the Ministry of Foreign Affairs, where they are trying to see how do Kenyans from abroad bring skills back at home, so that the nurses are able to internalize, they are able to know what happens abroad, that we can improve care, that we can improve attitude. Many years nurses were known to have very bad attitude, and even currently some of nurses and even public are struggling with issues about nurses, that they have bad attitude. But I want to say that things are changing, things have changed. Nurses are becoming empowered. They are the ones who even want to lead hospitals because they know the importance. They know that patients need to be saved. They know that we need new policies and guidelines, and these are changing each time as we go on. Like I want to say, currently with the Ministry of Health, we're trying to see that we reduce maternal mortalities at any cost, because we are struggling with that. And we want to improve with the 3 Ds in maternal health. The 3 Ds are delays. What is this that delaying decision making in emergencies at the grassroots? That a mother can be able, a decision can be able to be made very fast, and this mother is able to come to hospital. Then the second thing, the second D, is the mode of transport. From the time that this patient is having complication to the time this patient is reaching the hospital, that duration matters a lot. A mother probably who has bleeding coming from Garissa to Nairobi, will that mother be saved? So as the Ministry of Health and the Midwifery Society, we are trying to push nurses back into the society where we can have the birth attendant nurses reaching in the societies and helping these mothers. And what we are doing, we have introduced something that is now being embraced called point of care services, where you can be able to have a small ultrasound machine, check the mother at her home, see how the baby is moving, see what is the complication, see where the placenta is, and be able to call for emergency services to help this mother. And the third D is at the hospital when the mother reaches there. The delay in care, making decisions, oh, we don't have money, oh, we don't have deposit. And I can truly say, for where I work at Kenyatta University Referral Hospital, any patient, any mother who comes, even an accident victim, currently as we talk, there's an emergency fund that in a patient who comes, we open the emergency fund through Social Health Authority, and this patient is treated. That is the only way as Kenyans we are going to save lives. So those are some of the things that are coming up that we are trying to see in our society that we are able to improve.
Yeah, I want to look at, for a very long time, we have nurses who are graduating, but absorption into the industry is very low. The reason why you find that there is what has been touted as the brain drain. Kenyan nurses are really leaving the country in droves because there are great opportunities out there. And seeing what this then means to our hospitals or to our healthcare, then one would want to ask the question, when will we address the problem? And I want you to talk about do I talk about remuneration or the pay that nurses do get out here that is forcing many to leave the country and seek employment outside the country? So how has that affected the numbers of nurses that we have in the country, the brain drain that you continue to experience, and what would be then the solution moving forward?
Thank you so much. What I can say about this migration of the nurses, this is something that we have seen happening for a long time. And I can give you an example. I graduated from Nairobi Hospital in 2003 as a nurse. And currently, all my classmates, we are around 60. I think we are only around less than 5 who have remained in the country. And I'm talking about 2003. Majority have migrated and they have gone. So this brain drain seems like a problem that will continue to occur because it is an evolving issue, a revolution issue, where people are trying to go and find what is best for them. And it may not only be in nursing, because we have seen it is also happening in other countries. Like if you check like countries like Canada, you find the migration is from Canada going to Australia. And those who are in the UK are migrating from the UK going to Canada. You know, there is that movement of nurses, traveling nurses. So what about Kenya? Kenya, what is happening is that the nurses it's taking quite a long time for a nurse to get the satisfaction of the job in terms of the remuneration. We do have the satisfaction of humanity, of saving the life, of giving all that you can. But there is this other side of the remuneration that eats up the nurses. And that one I can say because currently you'll find that majority of the nurses are trying to meet their ends by working 2 or 3 jobs. So you find a nurse is working in KU referral and has to get a locum somewhere else. And I want to bring up issue about also nurses also who are male nurses. There is something that people have never realized that is really needs to be talked about. You see, when a male nurse is the one who is the breadwinner of the house, you find he needs to pay school fees, he needs to take care of the in-laws, he needs to go to school, he needs to do a lot of things. And you find that the salary that this nurse is getting is a little bit constraining compared even to the female nurse who is probably a wife where the husband is maybe giving her food, giving water and all that. So you find that they are really struggling, and they say, if I'm struggling to have 2, 3 jobs, and yet I can still not meet my needs, I am still having loans. Majority of the nurses to move and do projects, me being one of them, for me to have moved, do projects when I was a young nurse in a Nairobi hospital, I had to take a loan, and I've taken loans for the longest. And this comes with trying to empower our leaders, that we nurses need better remuneration. And we really thank the union. Sometimes it comes up very strongly to defend the nurses. And some years back, it came up with the allowances. These allowances are the ones that are actually driving the nurses. And I'm looking at a situation where this country, one time, through our leaders, the ministry and the president, we can be able to be given and practice allowance. Because when it is going to beef up even our allowances so that the nurses are able to settle and be able to give better care. So you find the brain drain will continue if nurses are not going to be heard, if nurses are not going to be retained. Because I can tell you, behind the curtains, whatever goes there, if you are to peep, you will say, oh my goodness, these nurses work. And especially, we don't like giving up. You can find a nurse standing the whole night, saving a life of a patient. And then in the morning has to go and rest, probably the handing over, that takes also a long time because you must hand over your patient properly so that care can be continued without gaps. So you find the nurse will go back to sleep, those who do night duty, and sleep for very few hours, and they are back to work. And this some of the careers that we do have and the work schedules that we have, you find even some of them not even manage to do the second or the third job. So they are remaining there, stagnated in one position, And even the ministry is trying to see how can it improve even the career progression for the nurses. Nurses in the past and even currently, some of them are stuck in one job group for quite a long time. So what happens? They feel, if I go to the UK, if I go to the US, probably life will be better. I'll be able to help my family. I'll be able to help my parents. I'll be able to do this project that is stagnated here. And I'm calling upon the nation, I'm calling upon the leaders to support nurses at any given point they can. Like for some of us who are almost in less than 12 years to retire, we have the fewest in the hospitals currently as we talk. Majority of the nurses are around 23 years to 30 years. And all of them are singing about US, UK, Australia. US, UK, Australia. What is going to happen? Remember, they are in the group of the Gen Zs. Yeah. They're unstoppable. So when they make decisions, they will go. I plead to the country to make our young nurses, because they have the workforce, they have the strength, they are unstoppable. We need to see how we can retain them, but we cannot also refuse them to go. Yes.
I think let's take a short commercial break on that point, that it is important for us to sit down and look at the nursing fraternity, how we will protect them, how we will take care of them, and most importantly, retain them. Because whichever way you want to look at it, even if you look at the ratio in terms of patient to nurses in the country, that number is staggering. We take a short commercial break. We'll be back with much more. Thank you for watching KTN. Welcome back. This is Health and Wellness, where we say your health is your wealth. We're having a discussion around the nursing fraternity in the country, and together with Jacqueline, we're just going through the role of a nurse in our hospitals, the quality that they bring in there, and how much we can take care of them. But while during the break, I just looked at stats, and let me just read them. In many public hospitals, one nurse serves about 30 to 40 patients per shift. In some county hospitals, the number is even up. We're talking about 1 to 100 patients per shift. That number is staggering, because one asks the question, how then is quality of service when you're dealing with so many patients at a time? And that notwithstanding as well, one asks the question, we will talk about nurses, we will look at the resources that they bring into our hospitals, their importance into our health facilities. But what don't we know about nurses?
Thank you so much. Something that the public does not know about nurses is that the nurses are the ones who are like the best commanders in the hospital. Remember, if the best commander is not able to stand up and give you the orders, if the best commander is sick, if the best commander gives up, if the best commander says everything stop, things are going to stop. Why am I saying this? Nurses are very key in the hospital. They may be silent and other voices may be louder, but they are the ones who are making the sweetest honey in the hospital, because they are the ones who are busy running around to look for the best that the patient can be given. They are the ones, with or without tools, they will make sure that they save a life. So I want the public to know that when it comes to saving a life of a human, the nurse has an unwavering, unstoppable character. They will use anything to make sure that they save the life. If it means that this nurse is going to pump that heart using their hand, even if there is no oxygen, they will do that 100 times, 500 times, whatever time, until they reach a hospital or until a doctor comes or until expertise comes. If we talk about delivery of a baby, and probably there are tools that are not there. As you saw one of the nurses when he was featured, one of the best nurses in one of the counties in Garissa. This nurse uses a torch to check on the mothers who are in labor. And what do you do? If you do not have a clamp, you'll have to improvise something to make sure that the cord is clamped and the mother and the baby are well. Nurses do things behind the curtains that somebody does not know, just to make sure that the patient is well.
One asks the question, where does that ingenuity come from? Is it inborn? Is it that nurses are just individuals who think on their feet and solutions have to be found?
What I can say is that once you have been embedded that skill of quality, that skill of humanity, and it is in you, and you know that it is about me and this patient. This is somebody's mother, this is somebody's husband, this is somebody's daughter or dad. That is what makes a nurse feel that I must save this life. And that is why when we talk to the theme of this year of the International Nurses Week, when we talk empower nursing saves lives, this is very critical because we want our nurses to get the best education, academic, speciality. Like in Kenyatta University and Faro Hospital, we have fought to ensure that we have a school of nursing. As we treat the patients this other side, being a referral hospital, it brings patients who are complicated. We had to start a school of nursing where we are able to do theater, we are able to do oncology, we are able to do critical care, and nephrology, dialysis, empowering them. And we're making sure all of them are going to school so that they come back and give the best. Because when they have the knowledge, when they are empowered, it becomes in them, it becomes embedded in them. I want to say that it's like a child. When you educate a child and tell the child, Mama, Papa, this is wrong, don't touch this, don't do this, the child grows up knowing that I should not touch this, I should not do this. And that is how nursing is. Once we have been trained, empowered, and these skills are embedded in us, we are thirsty to transfer them to the patient and give the best. That's why you'll find over the years, experienced nurses are very proud about their work because they see a patient and they know if I do this, if I tell the doctor to do this, this is going to be fine. And that's how you find the motivation, the character, that dignity, that commitment. It comes out because of being empowered, and it just becomes part of you. You walk, you're talking about what you are doing, yeah? And you feel so nice. And something else that people don't know, when you have done something good, when you have saved a life, when a patient has gone home smiling, feeling well, and sometimes patients come to the hospital, maybe they were not even very sick, but the way that nurse is going to receive that patient, the smile, the warm hands that the nurse is going to give, that patient, that's the healing that starts there. And you find that if it is a culture that is developed, something that I would wish to tell you, so we want to institutionalize cultures, mentorship, coaching, where people who have not taken care of patients and probably they are even new from school, we tell them, this is how we do it. This is how we need to treat our patients. And when you have a society with a positive culture, that's what we're working so hard at KU Referral, to make sure that the culture is right. And even when we do our interviews, sometimes we want to check the culture. We want to see the attitude of this person. Attitude is the beginning of healing in a patient. How you talk to that patient. And I want to give an example. You can just come as a patient, probably you're feeling pain, And the nurse probably is also very busy, maybe has the 50 patients, we're talking about the ratio, and the patient also is in need and ask a question. And it maybe says, give me some water. I am feeling thirsty. The way you will answer that patient, remember the patient is in pain, but the way you will answer that patient could increase the pain or could reduce the pain and make that patient feel better, even before you give the drug. Because when pain is there, the pressure goes up and the systems do not work well. But that soft voice that you will give and say, I am here to assist you. I'm here to serve you. Give me 1 minute. I am coming. Even if you're busy, I say, give me 1 minute. I am coming to attend to you. It saves and heals a multitude of other things that would have come up. And that's where healing starts from. Yeah.
I want to look at, we've talked about the value of nurses in our hospitals, but I want to look at the numbers, one nurses vis-a-vis our 50 patients in our hospitals, or 1 to 100. How does that affect quality of healthcare in our hospitals? And if you had an opportunity to speak to policymakers, to speak to, say, the ministry, to change the situation, let's look at these numbers, how they affect, and the solution moving forward.
Thank you so much. Indeed, I can tell you, even if you're the best nurse, even if you want to give all, because we have, like for me, I have the policy that I give all until I have nothing else to give but myself. What does it mean? You have tried all your best, you have probably resuscitated, and your patient is gone. And you are standing there probably crying, very sorrowful, wondering what next. So we want to avoid reaching such situations where you have worked tirelessly. By doing what? By ensuring that our ratios are improved. If the ratios are improved, the work division becomes easier. You are able to internalize your patient's needs. You are able to realize a patient complicating. You are able to improve the outcomes of that patient. But it becomes very difficult when you probably, like you are, want to put an example, when things are constrained, you find you have maybe even 20 patients with 2 nurses, and probably the patients are in the cubes, and you have given all you can and you're giving your best, but a patient is complicating in one room and you're in this other room, and you are probably only the 2 of you, and one has even taken the patient for x-ray, so you have remained alone. So if a patient happens to collapse, the rule is at least you need to be not less than 3. Somebody to support the airway, somebody to do the resuscitation, somebody to give drugs. So if you are alone in the ward, your friend has taken another patient maybe for x-ray, and probably the doctor has gone to review another emergency, you'll remain helpless. So if we are able to improve the ratios of nurses in the hospitals, in the critical care units. Personally, I'm an expert in critical care and worked during COVID times. And I could see what ratio means when it came to COVID times. You bet a patient and you move to the other patient to die. Then you hear you're being called, oh, that patient is not breathing. Then you run there. Then you're all over. So at the end of the day, you find you as a person also, you may end up being resuscitated. So whom will you leave your patient with? So for the policymakers, we want to request that we need to have better ratios for the nurses in the hospitals, in the critical care units, because quality cannot come when the ratios are down. Even if we have the best hospitals, I'm talking of good hospitals, private hospitals, public hospitals, if we are able to muscle up together, I'm talking about even funding. If the government is able to increase funding for the hospitals to be able to employ more nurses, you may find there is goodwill from the CEO, from the board, in the various hospitals. But you are told, no, stop, we are waiting for funds to come. we'll recruit when funds are available. So let us prioritize healthcare. Let us prioritize quality of services. Let us prioritize giving nurses jobs so that they do not leave. Because you find this ratio, that one nurse will feel tired, again, find themselves have gone to the US. They start doing the NCLEX slowly, chini ya maji. Then the next time you hear somebody is going on leave, then the next time the person is gone. But we can retain them when they know that also we are a team. You know, a bee cannot make honey alone. Just the way I started my statement. They need to be many bees and even protect the queen inside there and be able to make sweet honey. But if you are alone, you are incapacitated. You may not do much. So if we are able to be increased for funding and we are able to employ nurses, we are going to improve healthcare because, you know, we are the backbones. Yeah.
In the healthcare in the country.
Yeah.
And with the Nurses Week that we see that is being celebrated as we speak at the moment, what would be the clarion call not only to policymakers but to Kenyans as well? Because, you know, many get to hospitals and everyone is a doctor. You know, everyone is a doctor. But here we are now talking about nurses. What would be the clarion call when it comes to the treatment of nurses in our hospitals across the sphere?
Thank you. What I would like to say is that the theme for this International Nurses Week, it says our nurses, our future. Empowering nurses saves lives. So this calls us to be able to release funds for our nurses to go back to school. This calls us for us to be able to release our nurses. Many times, just the way we have been talking that we have very poor ratios of 1 to 10 or 1 to 20. The same nurse also needs to go back to school. So if we do not improve the ratios, whom are we going to release to go to school? So we are calling for the government to also change its pivot, to change its kaleidoscope and focus on the nurse. Focus on this individual to go to school, release funds. Because I know the other issue is about funding for the nurses. We have various specialities. We have now PhD programs, like Chuka University has already done several graduations of PhD nurses. And we also have Aga Khan University there starting its program on PhD. It's talking about advanced nurse practitioning, where now the nurses are being empowered, that they are able to prescribe some medication. And we want this advanced nurse practitioning. It's something that is new, that is emerging in nursing in Kenya. It's being practiced in the US, but I want the government to embrace it so that we are able to reduce the workload, especially if you look at the counties. The counties, you find that the nurses are few. And if you release even one of them to go to school, you find that making decisions also becomes very tough. So if they are empowered, if they have gone to school and we have the advanced nurse practitioners already at the county levels, they are able to make quick decisions about patients, and we are able to improve lives. So we are calling for even the policy makers to, when we are strategizing, as we made together with even the director of nursing for Ministry of Health, because she is also Madam Awinja, Judith, she's also trying to push as much as she can to ensure that we are able to get our nurses go to school. So as she pushes, we ask the government to support this initiative so that we are able to save lives for our patients, because that is all I know. We improve the ratios, we give funds to the nurses, we get philanthropic who can be able to sponsor them, and above all, we can also do observership programs, ministry and even organizations. Let us have these observership programs where the nurses can go to the US and be able to see how does it work there, and then come back, because they are going to save your life, they're going to save my life once they know better practices. Yeah.
Dr. Allow me to call you that, because I'm just another Kenyan who nurse is daktari is nurse.
It's okay, yes.
But we want to look at, briefly, because time is also not on our side, we just want to look at what is your clarion call. We've talked about Kenyans, we've talked about the leadership, but to your fellow nurses, because there's also been a conversation out here that nurses and doctors don't meet eye to eye. I don't know how true that is. Doctors feel like they're bosses, they're better than nurses, and that creates a problem in the hospitals. Is that true, or is it something to be debunked?
I can say it can go either way.
Yeah.
But what I can say, it begins with attitude issues. Attitude and what do you perceive? Starting from as individual, and then what have you been trained to do?
Yeah.
What is your role? Because the doctor has his role, and as a nurse, you have your role. If the nurse understands her role well, then there will not be any conflict that will occur.
Yeah.
Because she will know, I'm supposed to do this. I'm supposed to give the patient drugs. When the doctor has prescribed, I need to give the drug. But even before I give the drug, I have to check and confirm with even my colleague and see if this is okay. Because you might also be able to also ask the question, why, when, how could it be? May I ask, you know? It's how you ask. Because sometimes the doctor may prescribe the drug and you will need to find, doctor, did you mean to give this? Do you know, you will find probably the doctor says, oh, sorry, I think we can do this.
Yeah.
So the relationship on how people communicate matters a lot. And I want to call upon nurses, because personally I trained in Nairobi Hospital.
Yeah.
And from the basics, then Mata, I went to Malawi, and then I was in Aga Khan. And the culture that we were trained was a culture of learning to let the doctor be the doctor and make the decision, and you be the carer. And if there is anything you would want to find out, find out in a polite way. We do this thing that is called giving the report to the doctor. You start by saying, doctor, this is the patient, is called so and so, he has come with this and this, and I have done this, and I am feeling that this could be the problem. What do you think? You see, those are direct, nice conversations. And the doctor will say, before I come, ensure you do one, two, three.
And
so
I think,
those roles are there. And the mutual respect is also there.
Also there.
Yeah.
The roles are clearly defined. And I just want to, unfortunately, we would talk about these time on end. But from busy wards to rural clinics, nurses remain the backbone of our healthcare systems. Our nurses, our future. Empowering nurses saves lives. We want to thank you, nurse, for being here with us today. And we want to say asante sana for taking us through the role of nurses in our healthcare facilities. We continue to give you your flowers because you're the ones who, pretty much like you've said, you are the commanders of these hospitals. And we want to say asante sana. Jacqueline Tindi is the Deputy Director of Nursing, Kenyatta University Teaching, Referral and Research Hospital. Health, as we keep on saying on health and wellness, is your wealth. My name is Dennis Aseto, and to my entire team that made this production a success, asanteni sana. I give you your flowers, gentlemen and ladies. Edu, we have Mr. Saisi, we have all the producers in here. Asanteni sana, and we say, till next time, keep it KTN.